This is going to be a video for dental assisting on retraction and aspiration technique. First thing we do is have the assistant place Vaseline on the patient's lip, and especially place them in the corner of the lips. Now these retractors protect the lips and also keep the lips out of the way. So when you place these, there's a technique. Use your mirror to retract the cheek on that side, then place this retractor, then come back with the other side and place these. This is for an adult and this is for a child or somebody with a real small mouth. This one's a lot taunter than these are.
Do you want to get CE credit while you're watching Dr. Cutbirth's training videos? I know the answer is yes. So click the link in the description below at dentistrymasterclasses.com. It only costs $20 per month. And right now you can join for 99 cents. This is a steal. You are not going to want to miss this deal.
So this is one way to do it. And this is good when you're working in the front of the mouth. This one's hard to work with if I'm working on back teeth though, because this gets in the way. When we're working on back teeth, we use these single retractors, and you again retract with your mirror, and then I can work back here, or you can retract the other side like this. Now I like, if I'm working on upper teeth, using this, we call it the skinny mirror. Something else that's very, very helpful are we call them tooth rests. This is a large and this is a small. Now I try to use the large if I can because it gives you more vertical space to work. Now open please, Brianna. So if somebody's got a mouth that's large enough, this is good. Now this is not good if you're, say you're extracting a wisdom tooth because the coronoid process gets in the way. You want to use the smaller one. But if you're just working on a tooth, this is normally good, and it's easier for me to work with this mirror than it is this smaller mirror. You can see how much light and how much tooth structure you can see. So if we're working on the left side, Louisa, or my assistant, will use this retractor, and I'll place this here, and then she'll blow air on the mirror. If we're working on my side, let me place this for open, please. I'll place that first, and then you can use either the small end. Sometimes that's easier, it gives you more space, and you want to hold that. And then I'll work with this mirror. And then I can do whatever I'm doing, to me, more easily than using just one of these small mirrors. Okay, so when we're working on the bottom, on the lower teeth, if we're working on my side, then I'll use either my mouth mirror, will work like this, or more often than not, I'll use a single retractor, either the large end or the small end, just because it gives me more space for the handpiece, and Louisa will retract the tongue with her mouth mirror. Now the objective of retraction of the tongue is not to pull the tongue away, is to keep the mirror, the head of the mirror, between the tooth and the tongue, so the handpiece burr does not touch the tongue, and it keeps the tongue out of the way. But you're not trying to pull it over, you're just trying to put the head of the mouth, the mirror part of the mouth mirror, between the tongue and the tooth. So if we're working on the other side, then Louisa will use the retractor, and I'll use the mirror. And see, I'm just putting the mirror between the tongue and the tooth to keep the tongue away from the burr. And then I won't be using a mirror on the bottom. I'll just be looking directly. If we're working in the front of the mouth, then that's when we like to use these double retractors. And I can work on a front tooth here, a front teeth down here. And if somebody's got a small mouth, you may use this smaller tooth rest. I try to put the tooth rest on my side, not my assistant's side, because she's aspirating. And remember, when you're aspirating, you want to aspirate at the back of the mouth. See, this is a smaller retractors. So I could work here or work here. So when she's aspirating, this is what gags people, is water in the back of the mouth. You don't have to aspirate right here. Or if you want to use the larger aspirator and this aspirator, if my assistant's not having to keep the tongue out of the way, then aspirate with this aspirator in the back and this one right here. But patients gag when water gets in the back of their mouth, so you always want this one. Don't you always put that one in the back of the mouth, not in the dead back of the mouth, but on the side of the mouth, and maybe even turn their head this way a little bit so the water doesn't run directly to the back of the mouth. It's kind of on the side, but you're aspirating in the back of the mouth. And this aspirator is catching the water when I'm working. If I'm working on a front tooth, it's catching the water right here. If I'm working on a bottom tooth, then I'll usually hold this retractor like this. You see, this is catching most of the water. Then anything that gets past this, Louisa's aspirating that in the back of the mouth. So that's the dental minute. These techniques work, and they work every time.